Let's talk about Miss Milli Tanner, a young girl that was diagnosed with bowel cancer at a very young age. From the age of 19, she visited her GP several times. I think reports say she went at least 13 times to see her GP. She was having symptoms of lower back pain, severe stomach pain, and blood in her stools. But her GP kept dismissing her symptoms, giving her diagnoses such as POWS, which is like hemorrhoids, IBS, irritable bowel syndrome, and even told her that she was experiencing menstrual period disorder. Now, if you know IBS, irritable bowel syndrome, you do not present with blood in your stools is not a typical symptom of IBS. Lower back pain is not also a typical symptom of IBS. Neither does lower back pain or stomach pain present with POWS. Blood in your stool does not present with your periods. So I'm not sure where this GP were getting all these diagnoses from. It sounds like they were not even bothering to do any investigations because Millie had to take the matter in her own hands and she went over the counter, bought a stool test called a fit test. Now, a fit test will look for the presence of blood in your stools and it would help identify if you might have bowel cancer. A fit test usually means that you need to do a colonoscopy if it's positive. So Millie got this fit test and it came back as positive. So now she goes to her GP, and finally her GPs are now taking her seriously because they're thinking, okay, this stool test is positive, so now we have to refer her for colonoscopy. So I would assume that she did have a colonoscopy, which is usually done within 2 weeks of the results, and it came back as positive for bowel cancer. Millie had to undergo surgery, chemo, radiotherapy, and as you well know, these treatments are not without their side effects, anything from fatigue, nausea, vomiting, hair loss, weakness, lethargic, pins and needles in your hands and feet, poor sleep, as well as long-term side effects, long-term risks, a long road to recovery. And right now, Millie, from what I hear, is going through the menopause as a result of the treatments and cannot have children. Now, Millie is now 23, so I'd assume that this surgery happened around 21. But it is important that as young people, there should be more awareness about the symptoms of bowel cancer. So if you're having what we call red flag symptoms, they're early warning signs, look out for any blood in your stools that is persistent going on for several weeks. It might be even for 6 weeks or more, diarrhea or constipation, which are changes in your bowel habits that you do not normally have, feeling persistent bloated, regardless of whether you're eating or not, you just feel persistently bloated, or you might feel like you're pregnant. You might be experiencing fatigue, loss of appetite, feeling full quickly, weight loss as well. Any of these symptoms, please go and see your doctor. Do not wait for the usual guideline of I have to wait 6 weeks before I see my doctor. See your doctor straight away because the earlier, the better. And if your doctor is not taking you seriously, maybe get a second opinion from another doctor. If that second doctor is not taking you seriously, you might have to take matter in your own hands. Maybe if you've got the test that's available over the counter, such as the stool fit test, go and buy the test and do it. If it's not available over the counter, and if you can afford to, please go and see someone privately. Worst case scenario, go to hospital. Sometimes in hospitals, they would at least do some tests, or they would write back to your GP asking them that they have to do these tests. So do not just rely on, oh, I've been to my GP 13 times and they're not taking me seriously. There are other avenues, over-the-counter tests. You can go private or even going to the accident and emergency department, even though you might think that you're wasting people's time. It's not an accident and emergency problem, but these are last resort options that we're talking about. Because look at this young Millie here. At the age of 19, imagine if this had been discovered early. Okay, this would have been able to preserve her fertility. She would have been able to have the bowel cancer treated much earlier, and she would not have maybe required a permanent stoma, because now she's got a permanent stoma because the portion of the cancerous bowel has been removed, which means that she cannot pass feces, through the normal way into the rectum. So now she needs a bag where she has to pass feces through. And imagine the inconvenience of having to change a bag all the time, 3 to 4 times a day. The social aspects of if you're at a party and you have to go into a toilet or find somewhere to dispose of the bag, it's not very convenient. So just remember, you are never too young for any condition. Cancer is not an ageist condition. You don't have cancer when you're 60 or 70. It can happen at any time. It can happen when you're 15. It can happen when you're 5. We've got 2, 3-year-olds with cancers like leukemias, all sorts of cancers. So cancer has got nothing to do with age. If you have any of these symptoms that I mentioned about, whether it's bowel cancer, stomach cancer, or some form of cancer, please see a doctor straight away. Do not go on Google or AI or any of or social media or TikTok See a doctor in person. You cannot replace a doctor with social media or AI or Dr. Google. Okay? I hope you've learned from this video. Please like, comment, and subscribe.